There is no doubt that patient no-shows are one of the most problematic aspects of practice management. With national rates just under 20%, patient no-shows are responsible for over $150 billion in industry losses annually. But no-shows don't just impact income. They result in wasted internal resources that can push up the cost of care, stifle provider productivity, prohibit efficient practice operations, minimize access, and delay care for the entire patient population. Let's begin with what's on everyone's mind. When most organizations think about their no-show rate, they are thinking about the associated revenue loss. You can get a good estimate for that in a few simple steps. First, you need to know your no-show rate. To find your no-show rate, divide your number of weekly no-shows with your number of weekly scheduled appointments. Next, you must determine your gross profit per appointment. Then, multiply this number by the number of no-shows for any period. A more complex formula can be used to project loss. Using this formula, a provider with an annual gross profit of $10 million and a no-show rate of 20% would have an annual per-appointment loss of $2.5 million. While these calculations show the impact of missed appointments, they don't illustrate the true cost of patient no-shows. Fallout from patient no-shows, like idle FTE hours and underused space or equipment, all impact your bottom line. In fact, patient no-shows affect all levels of operation. But what's worse is their impact on patient outcomes. When patients don't follow through with an appointment, the result is always delayed care. If not for them, then the patient who would have filled their appointment slot. Studies have proven without a doubt that delays in care have negative impacts on long-term health, increasing morbidity and mortality risk regardless of patients' underlying, preventable, or treatable medical conditions. A Harvard study identified as many as 1 in 5 patients delayed care during the pandemic, and 57% of those suffered negative health consequences as a result. Sicker patients are more difficult to treat, exacerbating resources and putting a greater strain on providers. They are also more costly to treat, impacting providers' financial margins. Increases in the cost of care are often passed on to patients, which can create new barriers to care, creating a vicious cycle. So why do no-shows happen? This has been a hot topic for research. Of several studies, many no-shows are a result of common access barriers like financial and transportation issues or conflicts with work or childcare. More yet, are simply related to the human condition. Most patients who no-show simply forgot their appointment or wrote the details down wrong. But there's another category of reasons that fall firmly on the shoulders of the provider. Emotional reasons, such as negative feelings from a bad experience, feeling disconnected from their provider, or perceived disrespect, are also common reasons patients decide not to show up. Additionally, fears about the appointment, be it a procedure or diagnostic outcome, can also be a factor. Beyond emotional issues, the patient's administrative experience can play a part. Long wait times are a frequently cited reason, and the phone experience is almost always responsible for why patients fail to cancel or reschedule. When a patient is experiencing anxiety about their visit or has a last-minute conflict, they are not likely to wait long on the phone. In fact, most patients will not wait longer than 2 minutes in general. In these instances, no-shows can be minimized when providers focus on the patient experience by providing more personalization and better communication at the time of service, as well as more streamlined access.